All right. I'm getting the thumbs up from Thor, which I think means that we're ready to go. Good morning. Hopefully everyone else is coming out of their hibernation. I'm from Mississippi. This is cumulatively more snow in the last 12 hours than I have ever seen in my entire life. I do not have the shoes, pants, or any other equipment to be able to even walk outside, it turns out. So I think that, hotel sleep always hits different, but hotel sleep when there's a blizzard outside turns you into a bear and you just full on hibernate. So hopefully everyone's stretching, getting up, getting started for the morning. What a great pairing with your breakfast, but let's talk about hormones and body parts and body odors and other things that happen. So today we're gonna, this is, I don't know what that random R is down there. It's interesting. Preparing faux puberty. That's what we're doing. If you were here yesterday, I have experience working particularly with Wiedemann-Steiner Syndrome, but in general, I work with older autistic children with severe challenging behavior. I work on what we call our crisis team, and then I work one-on-one as a direct provider using acceptance and commitment therapy with level 1, what we used to call high functioning autistic kids, so kids that are mostly neurotypical passing, but a regular therapist might need some additional help working with. So that to say, my caseload tends to be 9 to 14 years old, and so really out of necessity, I got really into sexual health treatment using behavior analysis. As I mentioned, I'm from Mississippi. If you are familiar with American geography, we're right in the Bible Belt. This isn't a subject that comes easy to lots of families. In fact, we have 8 BCBAs in our clinic. And I always know when one of their clients is starting to have any behavior excess related to sexual health, because this is what happens. Hey, Lucy. Hey, Lucy, Lucy, I need you to come to my office with this parent right now. And so whenever I get that parent, one of two things is happening. Someone's bleeding, right? Because I'm also the safety officer. Or someone has started touching themselves and everyone's freaking out. Everyone's panic. It's like, whoa, stop, hold the phones. And the first thing we're gonna talk about today, oh, hi, I'm Lucy K. Jones, those of you that didn't meet me yesterday. Did we figure out going backwards? Nope, it's just going forwards. Okay. Well, anyway, the first thing we're going to talk about today is language, because that's the first barrier to being able to talk about puberty with your child and with your child's providers. So everyone just take a deep breath, because we're going to say some words, okay? I'm going to say words like penis and vagina. You're going to hear me say the word masturbation. Okay, now I've said it, and you all survived. Look at you, you did such a good job. Y'all, I really didn't think that the BCBA in the office next to me was gonna survive the first time I said these words in front of her. I thought she was gonna faint. And she's like, she's a cool person. I was like, you have a kid, what's your deal? But we're not, these words are stigmatized in our culture. There's just really no way around that as a reality. So we do things when we're talking about body parts. We kind of talk around them. We use euphemisms. So we use kind of like context and subtlety. You know who's not great with context and subtlety? Children with communication and language delays. Imagine if you named something in your house, right? Like the microwave, right? Kids probably know what the microwave is. And then one day you decided, oh, well, now you're 13 and something has changed about you. And so now we're not going to call the microwave. I need you to start calling it something else. Children who have already have a hard time learning terminology, who already have a hard time mapping language onto concepts, who already have a difficult time with change, that's not going to go well. It's going to confuse them. So I get the frantic knock on my door. Lucy, I need you to come into this office. I need you to come into my office. And what I have is an excellent BCBA who works with me on the crisis team, and a well-educated mother who's a nurse. And they can't even explain the problem. They can't even explain what's happening to me. Not the problem, because it's not a problem. They can't even explain to me what's going on. So she has a new behavior that we're concerned about because it should be, a private behavior. And I'm like, guys, we got to get more. I need more detail. I'm not trying to be weird about it, but you got to. So I gave them my number one tip, right? So if you're not ready to say penis and vagina, that's okay. But let's refer to it as pelvis, right? That's where those body parts live. Pelvis is a nice neutral term. I call it my starter word. And I legitimately gave this mom, who is a nurse, and this BCBA, who is my friend, homework to just start referring to pelvis. They were like, okay, great. She's rubbing her pelvis on things. And I said, okay, great. Does she know what her pelvis is? And they said, no, probably not. Well, this is a child who we taught her what her elbow is. I was there when we taught her that. We taught her what fingers are. We taught her all of her body parts. But we skipped over this, right? We skipped over pelvis. We skipped over vagina. And we skipped over explaining what breasts would be, and she's coming into she's growing up. She's going to need to know these things. Now, that being said, I tell lots of funny stories when I'm giving this talk, because I do give this talk to parents pretty frequently. Again, there's not a lot of people in Mississippi who talk about sexual topics in general. So in my house, we use the medical anatomical terms for body parts. We say penis, we say testicles, we say vagina, we say vulva, we say breast, we know all the body parts. Or so I thought. My 4-year-old came into my closet because children don't have boundaries, and so I was changing, and my 4-year-old said, "Mommy, why do you have 2 penises?" I said, okay, say more. He said, "There." We had not taught him what breasts were at that point, and so he was like, "Why do you have 2 penises?" And I was like, okay, great. Well, now it's time for another lesson. That being said, it's awkward. I'm not saying, I'm standing up here saying it into a mic, but it is awkward to have these conversations. You need to practice, and you need to, and the best way to do that is with your partner, who I'm assuming if you have a kid that you have seen those parts on each other, that's a great person to practice saying those words to. Okay, so aside from the fact that exceptional learners have a hard time learning vocabulary, let's not make it harder by using euphemisms, by using metaphors, by talking around the problem, by changing the word. This will keep your child safe. Exceptional children are already at have a higher likelihood of being offended against, because there is an assumption that they either won't report or can't report. And if we don't equip them with the language to be able to report, that makes that true. And when people who are looking to offend against somebody are kind of screening children, one of the things that they look for is, do they know the names of their body parts, and will they say them? Because if they do know them, and if they will say them, they're less likely to offend against them because that child is a child that has the ability to report. Now, that's kind of a dark thing to say, but it's true. This is the thing. So if you have a little person in here, right? Like we've got little Tot over here. The time to start preparing for puberty is now. This doesn't have to be weird. So this is what, did anyone else, my mom was pretty cool about it, but did anyone else, like raise your hand if you had like a sit down talk with your parent, like a birds and the bees type talk. Okay. Was it awkward? Yes. Okay. So if we turn it into a production, and we, especially when you already, okay, so we are, again, y'all's children are predisposed to have anxiety. You sit them down, you're anxious, they're immediately gonna be like, red flag, what is happening? Like the internet got canceled, the iPad, something terrible has happened. So they're already are heightened. They're probably not even listening to what you have to say at that point because you're freaked out and they're freaked out. There are nice neutral ways to introduce these words to your kids. Assuming that your child still needs help with hygiene when they're younger, that's a great time because it's not weird to be talking about body parts when you already don't have clothes on, right? So this is as simple as, okay, we're gonna wash, again, all right, wash your legs, now wash your bottom, now wash your penis, now wash under your arms. So you come at it from a neutral way so that it's not charged with all of that stigma. The other reason to be neutral about these words that will help you in puberty is when you go to make rules in your house about your new puberty rules, it will help you if you can be very specific and very clear about which body parts can be out in which locations and which body parts cannot be out in those locations. So we're gonna talk a little bit, all right, let's see. Thor, can we figure out how to go back? Because it's just perfect. Yeah, go back one more. I just wanna make sure that I have covered everything. Okay, so far all from memory. I don't know. It's a lot of time trying to get my notes pulled up and my husband was like, listen, you don't look at your notes, you don't need them. Okay, so practical tips, preparing for puberty, right? Start yourself off easy, neutral but specific labels, pelvis, groin, chest. If you're not ready to use the medical terms, use those. They're specific enough and they probably don't have like a weird history for you. I strongly encourage you to get neutral with those medical terms. It's okay. They're not bad words. And the more you can teach your kids that they're not bad words, the more likely they are to have like healthy sexual boundaries and healthy sexual identity. And Auburn's gonna talk more about that later today. Use the routines that you already have, introducing names for body parts during bath time and other times, like when you're going to the doctor. Times when body parts are already a normal part of conversation. So that they don't become stigmatized. Be consistent in picking your terminology and consistent with use. I cannot tell you how emphatically, and I tell all of this is the first thing I tell all my parents. If you're not gonna use the medical terminology, please do not use something that other adults can't recognize. Please do not, we can't call it a fireman, we can't call it a cookie, we can't call it a yaya. We gotta have something that other adults can understand. And you gotta start early because your child's not gonna be able to shift gears later on. If your child is at school and something is hurting, they need the language to be able to tell an adult, and that adult, your child may already have a speech impediment and already have a communication impairment. And by not giving them clear and consistent language, we're putting them at a further disadvantage. So have the conversation, pair it with a glass of wine, whatever you gotta do to kind of shake off the weirdness of it. And then start teaching boundaries early. And sexual boundaries, right? Like I'm not gonna sit down with my 4-year-old and say like, okay, well this is, like don't have your penis out and when you're in public and you can't touch it, and that's what, he doesn't need to know all that. Make it age appropriate. We have a list, a very specific list of people who are allowed to touch the body parts that we have taught you are private. Mom and dad, yourself, which you don't have to include that on the list, but I highly recommend that you do. And then their doctor, not a doctor, not any doctor, their doctor. They know that their doctor's name is Dr. Story, and Dr. Story is on the list. Okay, so my daughter, she's now 9. She does know that I tell this story. She was 5, and she came to me and she said, Mom, something's wrong with my vulva. And I was like, I'm so proud of you. Let's go to the doctor and figure this out. So we go to the doctor. Well, Dr. Story doesn't work on Tuesdays, and it was a Tuesday. And so this very sweet and well-meaning female pediatrician walks in, who likes her bedside manner is better than our regular pediatricians. Like, Dr. Story is like business, and that's why I like her. She's very sweet. Maggie absolutely refused because we had taught her, Mom and Dad, myself, Dr. Story. And she just crossed her arms and she said, no. And so we had to unteach a little bit. I was like, whoa, hang on. We know her. She's okay. But why do I say teach specifically your child's doctor and not any doctor? Because anybody can say they're a doctor. Like, anybody can get a white coat. And so if you have a child who isn't going to be reliable in making those discernments, we have to be specific. Teach your child their doctor's name. They know. Now, does that mean that there's going to come a day where they need to see a different doctor and they cross their little arms and say, absolutely not? Yep, that's going to happen. It's the same way that when you teach body consent, and you say, no means no, you eventually are going to get a 4-year-old who doesn't want to get out of the bathtub, and they're going to say, Mommy, no means no. And you're like, I hear you. I did teach you that, and that's exactly what I want you to do, except for get out of the bathtub. Right, I'm not the only one that has to wrestle their kids out of the bathtub, right? That can't be just me. Okay, great. So teaching boundaries, the more specific, the better. The safer your kid's gonna be, the healthier we're going to be as we develop these things. And this leads us into teaching about private versus public. There's a lot that goes into the language concept of private versus public, right? There's private school and public school, which has nothing to do with sexual health. But when you have a really language rigid learner, someone who's really having to put in extra muscle to learn language, we've got to put in a little extra legwork to teach them private versus public. First step is you got to teach them which body parts are okay in private versus public. And then you have to teach the zones and the different types of private versus public, because it really isn't just, it's not just two categories, right? Because in your car is technically, is it private or public? Right? Is it private or public? So you can have a private conversation, right? It's a safe place to have a private conversation. If mom's in the front seat, you're in the back, and you need to tell her something that you feel is something that you want to that's personal like that. But there are other things that you can't do in the car. And so, you need to have underwear on in the car. I don't know if this is a universal thing, but anyone else I frequently work with kids who just ditch their clothes. That's their first line of defense. Anyone else have a kid that just clothes are coming off? We're just not, okay, great. So sometimes private versus public is just if you were here yesterday, you heard me talk about my buddy who didn't wear clothes at all. And I was like, all right, our first goal is wear pants. This kid still gets dressed in the back of the van every day because he will not put on a shirt until he absolutely has to. So this is how I teach this when I am working with exceptional children and their parents, and honestly with their BCBAs who are like, I don't know how to teach this. So we've got completely public spaces, and we teach them how do we discern what is a completely public space. One clue is look at what other people around you are doing, right? And so teaching them, like, if everybody else has on all their clothes and shoes, then it's probably a completely public space. We want to keep all of our clothes on. So good examples are things like the grocery store, being in the classroom. So like really public spaces. And then we talk about places that are semi-public, like being in the car or being at a relative or a friend's house. So this is where, again, you have to be specific, because it might be okay for your kid to rock out in just their underwear at your house, specifically your house. But what you don't want to say is like, well, when you're home, when you're in a home, you can do that. You just can't do that when you're outside. Well, they will very quickly make a connection. It's like, okay, great. Inside a house, clothes off. Outside a house, clothes on. Done. Learned the rule. I'm good to go. That's not exactly the rule, friend. We need nuance. Explaining that relatives and friends' houses are actually public spaces. And then start talking about private spaces, like being at home in your living room. Because there's lots of siblings here, and I'm dealing with this with a case right now where they're like, it's been fine so far for brother to run out of the bathtub and jump in sister's lap right out of the bath. It was cute. All of a sudden they're now 12 and 13 respectively, and it's not cute anymore. It's weird now. But we've done it for 13 years, and so now what do we do? And I'm like, well, and she said, I know the first thing you're gonna say is I shouldn't have let it go on this long. I know. You told me, make rules early and keep them consistent, and I didn't listen, so just I know that that's what you're gonna say. And I have worked with this family for a long time, and I was like, I wasn't going to say that. I was going to think it. But we can move on. But what I love about that family, she's very self-aware. She always tells on herself before I'm like, okay, so the doctor's exam room, teaching them that if you're with your doctor, that's an okay place to take off your clothes if you need to, right? Notice I say doctor exam room, because again, if you teach a very literal child, okay, you can, like, when you're at the doctor's office, that's an okay place to take your clothes off. Potentially, they're gonna get into the waiting area and be like, great, I can take these pants off. I do not have to deal with hard pants today. Not true. And teaching them which parts of your house are private versus personal. And personal is the word that I use for really, truly when you're in private, right? So this is when you're in your home bathroom by yourself, or when you're in your home bedroom by yourself. It's very specific. One of the common practices from like 10 years ago, when you would have a child with a disability, like in the school setting, and they would start engaging in masturbation because it's age appropriate and they just can't discern when it's appropriate and what settings it's appropriate and when it's not. Well, what they would do is they would send them to the bathroom. Just send them to the bathroom. Guys, send them to the bathroom is not a sufficient treatment plan. It's not a sufficient intervention, because what those kids learn is, okay, great, I can go to any bathroom and engage in this behavior. And that's not true. They're gonna turn 18 and they're gonna be doing this in a public bathroom, and they're gonna get charged with sexual misconduct. And it's not really gonna be their fault, because we've gotta teach them better. So really specifically teaching them your home bathroom and your home bedroom. I know I'm harping on this specificity thing, but that's where the money is. That's where the magic happens. The more specific you can be in teaching the rules, and the more proactive you can be, the better it's going to be. Okay, we're going to take a break from full on talking about, that's what Jason just took a sigh of relief. Jason's known me for a long time, and I think I might be embarrassing him a little bit. That's what he's like, I am a traditional, I can't. Lucy, please don't say penis anymore. Okay, let's talk about some practical tips for body odor, body hair and removal, bra wearing, menstruation, and then we'll get back to the super fun topic of masturbation. This is really just a, hey, if you don't know that these things exist, let me tell you, because even educated, well-informed advocates that we are, your own kid starts to go through this and you forget everything that you know. So let's talk about some practical tips. Body odor. One, alcohol wipes kill bacteria that, so that inevitably when your child forgets and they smell so bad that you cannot breathe, alcohol wipes. Method makes a nice brand from Target. They've got like a grapefruit scented one. Great, put them everywhere. Put them everywhere. Because honestly, there is, like, when you want to have a conversation with your stinky child, you don't want to be like gagging and holding your breath while you do it. So you want to start off by, like, in a dignified way, saying like, hey man, I think we might have missed something important today. I'm gonna give you this wipe. I want you to like really wipe off. Let's get that sweat off of us, freshen up a little bit, and then let's move on. So alcohol wipes, pro tip. Deodorant is a thing that children with different sensory need profiles will avoid for a lot of reasons. It's the same reason they'll avoid teeth brushing. It's like a really intense sensory experience. And so you might have to do some sleuthing to figure out what the problem is. Is it the texture? Because often, a lot of the times it is the texture. The texture of like a gel on their skin, ugh, they hate it. Literally, like I've watched them just do like this. Anytime their shoulders are up like the earrings, it's a good sign that that's not a sensory experience that they're enjoying. Use the roll-on deodorants. Use spray deodorants. Spray deodorant is also your friend because they don't melt in the car. Again, Mississippi, the cars get to be like 1,000 degrees on the inside. So keep it there. And if you have multiple children learning to wear deodorant at the same time, you can share it. You can just be like, all right, everybody arms up, we're just gonna spray you down all the way across. And they make unscented versions. That's the other thing, is that people underestimate. People talk about tactile sensitivity and they talk about visual stems and the lights, and they talk about auditory stems. We often forget the sense of smell as a sensory issue. And introducing a new smell to a child that's already going through hormonal changes can be something that they really, that can be a reason that they're avoiding putting, if they're missing part of that part of their routine. Body hair and body hair removal. One of the best. I mean, all the time I get questions from my female clients, and they're like, she wants to shave her legs. I can't give her a razor. And I'm like, of course you're not going to give her a razor. Like she can't. Like her fine motor skills have always been impaired. She didn't do well with the pencil. Like she's gonna hurt herself. Well, that's great because we live in a very technologically savvy world and we've got lots of options for hair removal. And again, this seems like common sense now. You're thinking like, well, duh, Lucy, I know that. I'm telling you, these are smart people who are sitting in my office who know these things, who are like, I don't know, and they panic. So just arm yourself with information. I don't know much about hair removal options and how to teach shaving for men. It hasn't come up yet. Also, I don't know if you met my husband. He's bearded with hair down to here, so it's not really a thing that comes up in our house. Okay, let's talk about bra wearing. They hate it. They hate it. It's the worst. If you also wear a bra, we can relate. It's not fun. Start early. Start tagless, start soft, search for sensory-friendly brands, and make them start practice wearing a bra early. And just avoid bras with underwires forever for everybody. Don't even try. menstruation, oh, guys, there have been so many technological advancements in the care for menstruating women in the last 5 years. It's incredible. If you have a female exceptional child, you need to know this. They make period panties now that are super absorbent. They're moisture wicking, and they're so comfortable. The days of me trying to convince a sensory sensitive female to put a pad on are over, because let me tell you, there is only so many times that they can pull that sticky thing off of their leg and then throw it on the ground and look at you like, how dare you betray me this way? So anyway, reusable. So I'm getting some laughs from the ladies now. There we go, we're warming up. What they don't tell you about this, right? A thing that they maybe don't get all the way into. First of all, have the period panties before you think you need them. Maybe even practice wearing them a little bit so that it's not new. You also need a laundry bag. So look for cloth diapering wet bags and practice teaching them to take their underwear off and put it in the wet bag so that you don't just have soiled underwear out everywhere. So that's a thing that you don't think about if you use disposable menstrual products. You might not think about what you need to do to be able to use reusable ones. So order the panties and also order yourselves the wet bags. They make cute ones, they make little ones. So just they're out there. If you would like specific brand recommendations, come see me after. I have a list of ones that work better and which ones. Some of them have charcoal in the liners, and so it helps with pH balancing, all that kind of stuff. The other thing that I frequently teach my menstruating clients to use is a peri bottle. So if you have given birth and then they give you the little, you can also have a bidet, but I have children in a bidet. It becomes more of a fiasco. But we teach several of our clients, particularly those that have fine motor deficits and might have a difficult time cleaning themselves while they're menstruating, to use a peri bottle to help keep themselves clean, since they are using pad products. Everyone knows what a peri bottle is? Looks a little squirt bottle. Okay, so it's like a little squirt bottle, and you put warm water in it, and it squirts and rinses this whole area off. This is a real classy move. This is why they let me come. Okay, great, you guys laugh. We're back to masturbation, yay! It is a myth that girls aren't going to masturbate. I can tell you that I have to do more intervention on female clients masturbating than I do male clients, and I think it is because everyone is prepared for young men to start masturbating, and they're not prepared for the girls. And I have legitimately had a dad who is a doctor, he's a medical doctor. He's like, well, girls don't really do that. And I'm like, sir, you have 4 children. Come on. So everyone's gonna do it, right? There's no way around it. If you ignore it, it's going to start happening in places that you don't want it to happen. If you try and just make a hard and fast rule about don't do that, it's going to start happening in places where you don't want it to happen and you can't see it. And it's gonna get messy, both in the behavioral sense and in a literal sense. I had a parent recently say, Lucy, can I make the rule that he can only do it in the shower and it just deals with and then it's private and it all cleans up on itself and that's fine, can I do that? And I said, yeah, that's a great rule for your house. I think that's a great option. I said, you're gonna have to be cool with the fact that he's gonna spend some time in the shower. You might be taking 3 or 4 showers a day. She was like, that's fine. That's fine. Said, I'm willing to pay I will pay the water bill, I will wash the towels. I just would like that to be the rule. I said, I think that's a great rule, as long as we have that understanding. Again, you just want to make really specific rules about it, and you don't want to teach them that's the thing you go do in the bathroom, or that's the thing you can only do when you're by yourself, because then they'll find other times that they are by themselves, like on the bus, and they're like, and they don't think of the bus driver as being there, and they're like, oh, I'm by myself on the bus because all my friends are gone. Therefore, this is a time that I can engage in this behavior. I'm following the rules. And then again, they get in big trouble, causes all kinds of problems. So when, yesterday I was in there with they're doing the financial planning, and she talked about all these transitions. This transition from prepubescent into puberty comes with, all of a sudden you have to teach so many new skills. And I am just talking about the physical, the physical side of it. Auburn's gonna talk about the emotional and relational side of it. So you guys need, again, is it fair that you guys have to become experts in how to teach things that you were not trained professionally to do? No, it's not really fair. Putting that aside, I'm gonna equip you with some things to be able to, some tools to teach your kids. And this is called behavioral skills training. It's a 4-step teaching process that is really great for teaching hygiene skills. You can use it with your young children, but it's really good to have in your back pocket when you do reach kind of this turning point, and you're needing to teach new hygiene skills and new personal health skills. So the 4 steps are instruction, which is just where you talk about it. This is a great time to read a book. There's so many great books out there now when I was young, you basically had the one little pink booklet that's like you and your body. But there's a wider variety of options now. It's a great time to watch a video if you can find one. Pre-read the books and videos, just to make sure that you're not getting any surprises, that it aligns with your family's values. Maybe you find a book that aligns with the terminology that you guys decided you were going to use and have been using all throughout their childhood, right? And if you can't find a book or a resource or a social story that fits with what you need to do, make one, right? And then you're going to model it. So a great thing with you, I talked about my 4-year-old coming into my closet while I was getting dressed. The truth is, our kids are probably running around while we're getting dressed anyway, so it's a great time to say, hey, I'm gonna do my morning routine. I'm gonna make sure that I put on deodorant. Okay, so I'm putting on deodorant. Now you do it. So then you rehearse, and so you practice. And the key to rehearsal, you don't have a rehearsal on opening night, right? By the time it's opening night, you're ready to go. So you don't want to do the rehearsal when you are trying to get out the door. This is where the most common mistake that I see parents make in trying to teach their child new self-help skills, is that they try to do this teaching as part of the normal routine. And it's in the morning, it's high stress, there's a lot going on. That's not really the time to teach your child a routine. First of all, they probably already have anxiety about getting in the car. Now you're making them do extra stuff. They're stressed out, you're stressed out, everybody's yelling at each other, we're late to school, yada, yada. The time to rehearse this is on a weekend, at night. Being flexible about when you're gonna practice this, being okay with the fact that you might just, on school days, we're just doing it for you. So that we can make the transition as easy as possible to get out the door. And then we're gonna practice doing this skill independently at a different time. And then feedback. Feedback in terms of, this is how we fine tune the skill, right? Because the first time that so the skill that my 9-year-old, that we're doing this with, is getting her own hair pulled up for dance. She waits to the very last minute that it's time to get out the door to go to dance, and she goes, Mom, I need you to do my hair. And I'm like, no, Maggie, you're 9, and you go to dance 4 days a week. You gotta be able to pull your own hair up into a ponytail. And so the first time, like 2 weeks ago, when she did her own first ponytail, it was not great. It was lumpy. Right? Everyone remember your first ponytail? No? And it fell out. But the feedback that I gave her was, Maggie, you did such a great job. You did exactly what I told you to do. You got the rubber band around your hair. It's all out of your face. You're not gonna step on it when you go to acrobatics tonight. Great job. Next time, why don't you try using a brush at any point? So the next time, she said, okay, I brushed my hair first, and then I put it in. And I used a scrunchie this time, and it was easier for me to do. I'm like, okay, great, love it. So we're getting better at that skill. So that feedback step is an important part. And if we try to learn these skills in the morning, or when we're crunched for time, we might miss that important opportunity for feedback so that they can reflect on that skill and learn on it, and that you can praise them for doing that skill independently. So a first line intervention from like a behavior support person when you're teaching personal hygiene routines is going to be a visual aid. And I love a visual aid. I just would like visual aids to be something that's like dignified for preteens. And this is more of a personal thing for me, because a lot of times if you like Google, I need a visual aid to help teach showering, what you're gonna get is this little board maker, right? Does this look familiar to people? Everyone's seen the little board maker icons? Okay. They're great, they're clear, there's value to those, but it's not super dignified. Right? If I'm a 13-year-old, a 15-year-old, I want something maybe that isn't up on my mirror like this. Maybe I don't mind. And so this is just my plug for some creative alternatives to visual aids and to build routines that might feel a little more palatable, a little more dignified for your adolescent. These little keychain guys over here, where you can slide them and you can make little checklists on them. They're small, they're great for routines. And so like so let's say you have a female child who is menstruating, and you order the panties, you practice wearing them, you've got the wet bag so that you can put them in there. Maybe on the zipper part of the wet bag, you put the little keychain that reminds them, hey, here are all the steps when it's time to change, right? Just as a little reminder. It's not big, it's not like a laminated board maker thing. It's something that's subtle and feels kind of appropriate for an adolescent to have. One of these little instant camera things, if you have an exceptional child, this is one of the most underrated tools that you can have in your parenting toolkit. Because if you can take an actual picture of a thing that you need them to remind them of, instead of having to find a picture that looks similar enough to it on the internet and then print. I mean, who has ink in their printer at home, right? I guess some people work from home now, so maybe you do. But like our printer is never operational. So being able to take actual pictures of parts of the routine, again, even that is a little more dignified, and it might even be a little more successful, because then your child isn't having to translate board maker to real life. And so you can use those, so either like the little Instapics that are like little Polaroids, or these. What this is a, it just automatically prints things from your phone, so you can draw or write whatever you need to download from the internet, and then print it really quickly. The friendship bracelet routine reminders is actually an ADHD hack from TikTok that I have adopted into my recommendations. I'm working with a 14-year-old female client who she's like, I'm just tired of my mom nagging me in the morning. And I said, that's fair. What's your mom nagging at you about? She's like, all the steps for getting ready. I said, okay, are you doing all the steps for getting ready? She said, no, I don't know what they are. I was like, okay. We've identified the root of the problem here, sweetie. So she and I talked about a system where so she's got the steps of getting ready, and they're on little friendship bracelets. And when she does one, she takes it from one hand and puts it on the other hand. So she knows, okay, I've finished with this step. And she likes it, right? She uses the system because she likes the system. If your child doesn't if the system is not aesthetic, if it doesn't make them feel dignified, if they don't feel like it's helpful and a good, comfortable part of their routine, they're not going to use it. Now, there's a flip side of the story of my client whose mom is nagging her. And this is the other good tip from a behavioral perspective, is that when you are teaching your child skills that are physical skills and not verbal skills, you should not be talking to them to prompt them. Odds are, and I'm a mom, I'm guilty of this too, you are verbally prompting your child through all of the steps of getting ready. Okay, brush your teeth. All right, rinse the toothbrush off. Okay, no, now rinse, wipe the sink off. Don't leave a mess. Okay, where are your shoes? Get your shoes. What we're doing is we're making them dependent on those verbal prompts. And they still need our help. And so we do need to prompt them. We do need to support them, but do it without the verbal prompt. Just bring their shoes and put them close to them as the prompt. Because then what they learn is the stimulus for them to put their shoes on is the fact that they don't have shoes on, their shoes are over there. Not you saying, hey, where are your shoes? No, seriously, put your shoes on. No, it's time to put your shoes on. Oh my gosh, where are your shoes? It doesn't matter, maybe they're in the car, we're just gonna go barefoot today, right? So use physical prompts when you are teaching chains of behaviors so that you can, when they're ready, fade yourself out. The other mistake that I see frequently when they're teaching these behaviors is kind of an all or nothing approach. It's like, okay, I've taught them, they've done it independently once, therefore I can just leave them to their own devices in the bathroom now. They've done this skill one time, it's good to go. Probably not. Once they have done it all by themselves one time, first of all, that doesn't mean that they're going to do it all by themselves tomorrow. Skills and adaptability fluctuates. It's not a regression necessarily. It's not that they're not trying hard enough. It's not that they loved you more on the day they did it 100% independently and now they're punishing you for being a bad mom, right? Like we can process all that later. So stay nearby. Because I all the time I get frustrated calls from parents. So like, Lucy, we did everything that you said. We taught the whole chain of behavior. She did it by herself. And then I was getting myself ready because she can do it by herself now. And I went in there and she didn't have any clothes on and nothing was done. Okay, well, we faded ourselves out too quickly. So do it gradually. Do it in steps. Kind of hang out nearby on your phone. Seeing if they need you, right? So let it be a gradual process that you fade out. Okay, great. I've got 10 minutes for questions.